First off, we're going to talk about the kitchen. We have, when you're using the stove, always make sure you use the back burner, especially when children are around. Keep pot handles turned away from the front so you can't hit them and knock them over on you and scald yourself. If it's an open flame like a gas stove, make sure you wear tight-fitting clothes and don't reach across the flame. Always turn it off before you reach across for anything. If you're using the microwave, make sure you always stir the food before you eat it. Check the temperature before you give it to children. About children with electrical cords. You want to make sure there are no cords pushed under rugs because they can become frayed and cause fires. Basically, this is about the kids. Don't leave matches or lighters around where children get to them. And always use child-proof lighters if you need them. Don't leave candles unattended. Kids like flames. They could think they're pretty and want to play with them. Can be burned. All right, next we're going to talk about the water temperature in the home. You need to set your water heater back to 120 to prevent burns and scalds. When you're bathing children, always turn the cold water on first, then add your hot water. Run your hand through the water, make sure it's not too hot for you. If it's too hot for you, it's going to be too hot for them. Okay, now we're going to talk about heaters in the winter. Keep anything that's flammable at least 3 feet away from your heaters, especially if you're using like a kerosene heater, because they can cause a flame, cause a fire, it can cause burns. If you're using like an open fireplace or a wood-burning stove, only adults should be the ones to add anything to the flame. Don't allow children to play with it. And there should be no horseplay around the stoves or the open flames. Okay, we're going to go outside to the gas grill. Well, not just gas grill, but charcoal grills and all. Never use gasoline to start a fire on the charcoal grill because it can explode into your face. Also, with gas grills, you want to make sure you don't turn the gas on and leave the lid closed before you try to light it, because that can also cause an explosion. You can lose your hair, your eyebrows, or your face. And once your fire is burning good, never add any more charcoal or use lighter fluid on it. It can cause an explosion in your hand or a flame up in your face.
Our skin is vital to the protection of our body against infection. It's the largest organ of the body. Once a burn injury occurs, it compromises the integrity of that system. Hence why it's important to always be on top of your care and preventing infection. Some good ways and patient teaching before you leave is to make sure you follow the next few rules for the prevention of infection of burns. First is your medications. Make sure you understand what medications you're prescribed, what ointments you're prescribed, and be sure that you understand the routine for applying them and how often. Next would be your wound care itself. This applies mainly to dressing changes, so ensuring you don't cross-contaminate. When you clean one section of your wound, make sure you discard that swab and start with a new on the opposite section. That way, the bacteria is not going to be cross-contaminating and you're just exacerbating your symptoms. Also, make sure if you're supposed to keep your dressings dry, you adhere to that, and your frequency of the changes as well.
Good afternoon, Miss Davis. How are you?
Hi, how are you?
I'm well. I'm not Misha. I'm your nurse, okay?
Okay.
I want to show you how to dress your wound.
Oh, well, I already did that this morning. See? Isn't it pretty? I picked the best one.
Oh, my dear sweet Jesus. Listen, sweetheart. I'm going to show you how to properly do it, okay? We're not... Okay, Miss Davis. Don't forget, before you put the gauze on, you need to put your skin barrier cream on, okay? Right before you put the gauze on. You got it?
Okay, I understand. But I still like my way better.
Jesus. All right, darling. Thank you. I hope you get well soon, okay?
Thank you.
Jesus Christ.
3, signs and symptoms of infection. It's pretty common, but make sure you understand any redness around the area, any swelling, discharge, and odor, and if you have a temperature above 100.4, to call the doctor and report those signs. Next would be your diet. Wound care, it's a skin issue. You want to make sure that you're intaking enough protein, as well as upping your vitamin C and your zinc intake. Make sure you're eating foods to make sure you're getting enough wound healing. It's a higher calorie intake that you're going to need, so make sure you understand that before you leave as well. Last is going to be support devices. Any wraps, bandages, anything like that, make sure you have the nurse show you before you leave and be able to demonstrate back. That way you can ensure that you're going to adhere to the program and you're going to get the most rehabilitation that you can get. Jackson. Miss Jackson. Good Lord, you scared me. Miss Jackson, I came here to talk to you about this procedure about your burn.
What you want to do now?
Well, you know that this burn is really severe, and I know it is painful.
Yeah, it's painful.
Yes, and at one time they used to have to come in and debrief. And they used to come in and
That's when you scrape it, and
up.
you're not going to be scraping me up. I'm already in pain.
Well, I understand that, but we got this new procedure now that we can do, and it's called
multispectral scanner.
It just takes pictures, and that's all it does, and it separates the living from the dead cells, and that's what they use to graft the skin with.
So you telling me they're going to use this little digitizing machine
Yes, ma'am.
and fix my arm?
Yes, ma'am. They don't even have to touch you.
They don't have to touch me.
No, ma'am. They just take a picture. Just like an X-ray machine. That's pretty much what it is.
When they going to do all this?
They're supposed to do it later on this afternoon, but I just wanted to make sure that it was okay with you, because you know we can't do anything without the patient authorization.
Am I going to get pain medicine?
Yes, ma'am. We're gonna make sure you get pain medicine as well. Are you in pain right now?
No.
Okay.
I'm just tired. I guess y'all can digitize my arm if you let me sleep. Can I sleep?
Yes, you can go to sleep for a little while, and I'll be back within about 30 minutes.
All
to
right,
an hour.
baby. Okay, thank you.
Right. Thank you, ma'am.
Hey Erica, I see you just got back from your spectral scan.
What?
The scan that they did on your arm. So I'm going to talk to you about the 3D printing. Wake Forest scientists designed, built, and tested a printer that will print the skin cells on the burn wounds. So it's like the ink is actually different kinds of your skin cells. A scanner is used to determine wound size and depth. Different kinds of skin cells are found at different depths. This data guides the printer as it applies layers of the correct type of cells to cover the wound. You only need a patch of skin 1/10 the size of the burn to grow enough skin cells for the skin printing. So bam, then you got skin.
So had an artificial arm now?
No, it takes skin cells and fills in your wound and makes skin.
So what's gonna happen?
Basically, you're going to go down and this machine is going to spray your skin into this wound, and your skin color will be the same. Everything's going to be the same. It's going to fill this wound in.
Oh, okay. So where do we go from here?
It's time for you to go to rehab.
We need for you to go to rehab. You need to go, go, go. The scar is black. Your skin will come back. It's gonna grow, grow, grow. Technology's right on time. You're gonna get healed up just fine. We need for you to go to rehab to make it grow, grow, grow. You got 5% at third degree. It is not like in the olden days. This is the first time there's no debris. Just lay your arm down and we'll take pictures. Then it's time for the surgeon. He'll take your dead cells. It's not so urgent. We need for you to go to rehab. You need to go, go, go. The scar is black. Your skin will come back. It's gonna grow, grow, grow. Technology's right on time. You're gonna get healed up just fine. We need for you to go to rehab to make it grow, grow, grow. After removing all the dead cells, the surgeon has one more thing to do. He's gonna take a little good skin and put it in a petri dish to get it multiplying. Then it's time to get some rest while your skin grows in the lab. That's the best. It's time for you to go to rehab. You need to go, go, go. The scar is black. Your skin will come back. It's gonna grow, grow, grow. Now you're ready for the end. We'll come get you and take you in. You'll just lay down your arm and get your new skin by printing it in. Then you'll need to go straight to rehab so your skin grows. It's time for you to go to rehab. You need to grow, go, go. You got your new skin and it will grow well. Grow, grow, grow. Technology's right on time. You're gonna get healed up just fine. We need for you to go to rehab to make it grow, grow, grow.
Yes!
Skin is vital to, you're gonna,
No lie.
I'm sweating like a hooker
You're-
in church.
I'm going gonna show you how to dress your wound, okay?
Okay, well, I did that this morning. See?
Sweetheart, you know. Okay, we're gonna show you.
I love that reaction, sweetheart. No, I love
I'm
that.
trying to be serious. Just don't take me a few times.
Okay.
It's so hard for me.
Your name is Miss Jackson. Sorry, Miss Jackson. Okay.
Whenever y'all get ready.
Miss Jackson. Miss Jackson. Miss Jackson. Oh, you scared me.
Just say, so is that,
How's it work?
yeah, well, so what's gonna happen?
Okay.
So,
So we pick up on all
Yeah.
that.
I don't like the humps.
I know.
So you can cut and paste.
I can.
Um, the, are we done?
Yeah, I believe we're done.
Thank you. I'm out of here.
You could have at least like dressed.
No.